Over recent years, the regulations surrounding pelvic exams have evolved at both the state and federal levels, especially in teaching hospitals. At the state level, over 20 states have enacted laws addressing pelvic exams on anesthetized patients. While these laws are detailed, there's significant variation in the existing legislation from state to state in terms of the type of consent required and who is affected. Now, federal guidelines have been developed, making informed consent a standard in medical education and patient care. In April 2024, the U.S. Department of Health and Human Services released federal guidelines to require written informed consent before sensitive examinations are performed, especially by medical trainees. This consent is essential to safeguard patient autonomy, protect patient rights, and promote trust between patients and healthcare providers.
We surveyed osteopathic medical students across the country about their experiences and beliefs involving informed consent for pelvic exams under anesthesia. In our analysis of 291 responses to our survey, we found that about 94% of students considered it unethical to perform pelvic exams under anesthesia. 83% of students likened this practice to sexual assault. While 99.9% of participants demonstrated the correct understanding of informed consent, only 26% of participants reported obtaining this explicit consent from patients. About a third of participants indicated that they had not been educated to obtain consents by preceptors or administration. Despite the high percentage of students who believed the practice to be unethical, a third of participants felt that they could not refuse to perform the exam when they were instructed to do so by a preceptor. 5% of participants reported refusing to perform the exam, and the majority of these students reported that they were later scrutinized for refusing to do so. About 93% of participants reported they did not know whether there was a state policy regarding explicit consent for this practice. Some also mentioned their perception of being in a unique position as a medical student, with the potential for their clerkship grade to be affected by their refusal of this practice.
First, I just want to reiterate that the U.S. Department of Health and Human Services, through the Centers for Medicaid and Medicare Services, state that consent must be obtained for pelvic examinations, regardless whether patients are anesthetized or not anesthetized. Currently, about 20 states have consent laws in place, and we recommend for there to be a universal consent law to ensure that informed consent is obtained for pelvic examinations. We recommend for institutions to implement protocols to ensure the practice of obtaining consent from patients prior to performing pelvic examinations. We also recommend institutions to make sure that medical students are aware of these protocols prior to starting their rotations. Additionally, we recommend resident physicians and attending physicians to pay careful attention to ensure that patients have provided consent for pelvic examinations if they are to be undergoing one. Lastly, in osteopathic medicine, we oppose the act of performing pelvic examinations without consent. It is our duty to respect patient autonomy and provide compassionate care, and in so doing, we need to ensure that consent is obtained for any procedure, including pelvic examinations.